Novel agents in myeloma is something very, very interesting, and it's very up to date currently. We know that after 1 or 2 prior lines of therapy, myeloma patients have already been exposed or even are refractory to the main class of agents we have available, PI, IMiDs, and anti-CD38 monoclonal antibodies. So we need now more agents, other mechanisms of action to rescue these patients now after 2-3 prior lines of therapy. What are for me the most important one, the most interesting ones? There are some of them approved, and I think here we can focus on Selinexor, the exportin inhibitor with activity with around 30% response rate for heavily pretreated patients, penta-refractory patients, even activity in patients with extramedullary disease. So this is the first one. In fact, it has already been approved by the FDA, and we also have it in Europe now. So the first point or the first mechanism important for multiple myeloma. The second one I would mention is Melflufen. Melflufen is this PDC, peptide drug conjugate. We have spoken a lot about it, and it's this is like a clever melphalan in which melphalan achieves high concentrations inside the tumor cells, are quite specifically inside of the tumor cells. This is also has already been approved by the FDA very recently, some weeks ago, by the FDA in combination with dexamethasone for relapsed refractory myeloma patients. And now it's been also combined with daratumumab or with bortezomib. And we have good data with daratumumab based on the ANCHOR study. In fact, the phase 3 trial is currently being started. These are the two ones, and I think these are the ones that have been approved along with the BCMA antibody drug conjugate, the Belantamab, which is the third one, also with activity and with activity in heavily pretreated patients with 30% responses, some of the responses very durable, and with the concern of keratopathy here, but I think well managed, or could be managed with a dose reduction. So Selinexor, Melflufen, Belantamab, the three ones, the novel ones that have been already approved. There are some other ones coming, which is the novel CELMoDs. CELMoDs are interesting. The novel IMiDs, here we have the iberdomide of the CC92480, both of them with promising efficacy, even activity in extramedullary disease. So good data for these agents. And finally, we will see, this is more for the future, other agents that could be interesting. And here we have, for instance, agents targeting some specific population in the myeloma of myeloma patients. Here we have a venetoclax. We already know it very well for 1140 translocation patients. We have the RAS, BRAF inhibitors for patients with abnormalities in these pathways. Maybe MYC. Also, we have also evaluated MYC in preclinically, and it could be also interesting for these patients, selected patients population. So I would say that the future is bright for multiple myeloma. We have several novel approvals, very recent approvals, and we will probably have more in the future months or years.